In every election, one issue cuts across age, income, and postcode: health. And in Australia, no health issue looms larger than Medicare. It affects every one of us. It's why our Prime Minister hasn't missed an opportunity to flash his Medicare card on the campaign trail, and why the Coalition quickly followed Labor's lead with their own Medicare funding pledges. In case you didn't know, Medicare is Australia's universal health insurance scheme. It's supposed to guarantee all Australians access to a wide range of health and hospital services at low or no cost. This is in contrast to private health insurance-based systems like the US, where the majority of healthcare is provided by private insurers and paid for out of pocket. The costs of doctor's visits, hospital services, tests, imaging and scans are all subsidised by Medicare, and if you have a Medicare card, you can access the pharmaceutical benefits scheme for subsidised medications. At the heart of a universal healthcare system is bulk billing, the idea that the patient does not have to pay to see a health professional. When you attend a bulk bill appointment for medical care, your doctor's bill is covered, meaning it's free for you, the patient. But finding a bulk billed clinic has been getting harder because not all health professionals follow this practice. In 2022 to 2023, patients who booked a standard GP consult had an average out-of-pocket cost of $40, and only 28% of patients had no out-of-pocket costs at all. How Medicare works is the government contributes a fixed amount for each GP appointment. This payment is known as the Medicare rebate. If you have to pay out of pocket for your appointment, that means you're being asked to subsidise the cost of your doctor's visit on top of the rebate. The rebate currently sits at $42.85, which means if your appointment costs $100, you'll be expected to shell out $57.15. Over the last few years, there has been a noticeable decrease in bulk billed appointments. According to a report by online healthcare directory CleanBill, almost 80% of Australian available GP clinics no longer offer bulk billing to adult patients. This decrease in bulk billing rates can be partially attributed to the fact that the Medicare rebate remains low, meaning that GPs' costs to run their clinics are putting doctors under the pressure to pass expenses onto patients. So what are the parties prescribing for this election? Labor has promised $8.5 billion to Medicare, calling it the single largest investment in the scheme since its creation. They're also committed to getting bulk billing visits back to 90% by 2030, with additional funding for doctors' training and nursing scholarships to boost the workforce. Additionally, Labor plans on investing $573 million on women's health and putting a $25 cap on PBS medicines. These investments were quickly matched by the Coalition, who put out a similar suite of election promises, including $9 billion for Medicare. Whether these investments will cure the system is yet to be seen, but what's clear is that Medicare, and how it's funded, will remain critical to ensuring healthcare stays accessible for all Australians.